Welcome to All Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello, and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, we want to say thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. Today, we are honored to welcome the team from Savvy. Savvy is helping to give voices to caregivers and patients. Welcome.
Thanks for having us.
It's our pleasure. Our pleasure. So, Jen, I want to start with Savvy. You're the founder of Savvy, the CEO. What is it that inspired you to create this remarkable platform?
Well, I think it really comes from personal stories where that happens for a lot of us that work in sort of the healthcare and patient advocacy space. First and foremost, I do identify as a patient. I was diagnosed as an infant with multiple autoimmune conditions, most notably juvenile idiopathic arthritis, along with many other rare and more common forms of autoimmune disease. So that was really kind of the life that I led growing up as a patient, in and out of hospitals and treatments and all sorts of things. I had the privilege of then, as an adult, getting diagnosed with a rare brain tumor and had that added to my list of different things to deal with as well. And so I've just been living that patient life since I was an infant. And it's what informed me wanting to go into healthcare. And so in doing so, I became a little bit jaded by seeing that even my own physicians couldn't practice the medicine that they wanted to. And so while I was pre-med in college, I decided against that. And instead, I became a human factors engineer and human-centered designer. What that means is it's really trying to look at how can we make the world fit patients like myself who maybe have different abilities or things like this. It led me into academia. I was a researcher studying what matters to patients and what we call patient-centered outcomes, and then was also an FDA advisor. And so through all of these channels, professionally and through patient advocacy, I saw that my professional colleagues were talking a lot about patients and truly wanted to help patients. They were just guessing. They just didn't have all the information that we as patients or as family members know the real lived experiences. And that was sort of the aha moment for Savvy, was when people started to ask me for my perspective. I really started to feel uncomfortable giving it on behalf of communities that I am not a part of, or even those that I am. Like, look, I'm just one person and I'm white with a PhD, have access to good health insurance and live in major cities. And so really the true genesis of Savvy was, how can we make it really easy and seamless for these companies and innovators and researchers to connect directly with diverse patients and caregivers so they can get input from the right patients at the right time as they're creating these innovations. And that's how Savvy started. So we are a marketplace for patient insights, connecting those companies directly with diverse patients and caregivers so we can co-create the future of healthcare innovations.
That's wonderful. And I know one line in the Savvy bio, Savvy empowers patients and the caregivers to co-create new solutions, which, being a caregiver, I'm sure that really is open to interpretation depending on the patient situation, right? It could be their doctor, their nurse, their therapist, or their in-home caregiver. Is that accurate?
Yeah, absolutely. We really want to create a place where all the stakeholders have a seat at the table and can use their voice to help inform these things. I think we put an emphasis on the patients and family members because oftentimes in healthcare innovations, we've kind of forgotten that they're ultimately the end users. But of course, providers and other types of caregivers are also included to make sure that their voices are heard as well.
Wonderful. And Vivek is joining us. And Vivek, you're the contract manager at Savvy. Is that correct?
That's correct.
Do you have any input or personal story that really inspired you to join the team at Savvy in this mission?
So I think I sort of stumbled upon Savvy. It wasn't something that I thought, okay, I really, really want to join this company. I was looking for jobs and I saw the mission statement and sort of the work that they do. And it really connected with me because as a child, I lived with my grandparents, and it was our responsibility to take care of them, in and out of hospitals constantly throughout high school. And it sort of made me think, all right, they care about caregivers. It's not just about patients. And maybe from that angle, I really do have a space here. And ever since high school, I've always tried to be part of organizations that actually have a mission or some type of meaning behind the work that they do. And it all just sort of connected beautifully, because I felt like I had that caregiver position, I had that experience, and I knew what it goes into taking care of patients, so I can understand what the ethos of this company is, or who the people on this team are. And at the same time, I felt like my legal background and the skills that I had to bring in terms of negotiation and things like that just fit perfectly for the role that was that they were looking for at that time.
That's wonderful. And Eriel, you are the community partnership coordinator for Savvy. Same question. Did you have a personal story or something that really inspired you to join Savvy?
Yeah, so I myself don't consider myself a patient. However, my mom and I both passed away on the table when I was born. And so, learning about the health inequities and just the gaps in the medical system is something that's always been very important to me because of that personal experience. We are both all well and good now, but she and I, going through life have continued to have a lot of issues with our healthcare providers. And so it's always been very important to me to find companies like Vivek said that have a real mission and really walk the walk as well as talk the talk, And
Right.
I think that Savvy is that company for sure. And so I really connected to the mission statement as well of bringing diverse patient and caregiver voices to the table, because when we have that diversity and when we have people who have different lived experiences participate in projects like this, it really makes it so that these services and the providers too, and everybody who's involved with healthcare innovation has a greater understanding in general of how to serve every kind of patient community rather than just one.
Well, and I like your shirt. It says "Ask Patients," and
Yes.
that's a Savvy shirt as well. Hopefully you guys will send me one of those, and we'll wear it on the show. So Jen, I want to ask you this question, and of course, if Vivek or Eriel have some insight, we'd love to hear that as well. Starting something like this and with a mission like this, it's a little bit David and Goliath, isn't it?
I mean, trying to take on the healthcare system
Yeah.
to get them to think about how are we going to include those historically excluded voices, those who essentially have been extracted from in the healthcare ecosystem, as we really think about, all the health data that people are learning off of or testing on as subjects in clinical trials. It's trying to restore some of that power and balance. And I think that something that Savvy does well is that we are capable of saying, here we are. This is our starting point. We're not here to throw anybody under the bus, but we can all do better collectively if we work together. And so people may have their own perceptions of healthcare as a system, of certain segments of the healthcare ecosystem, but we're not here to shame anybody. We're just saying, are you interested in creating meaningful change along with patients? Yes. Okay, then let's work together. So that's really, I think, why we've been successful, is understanding that the individuals who work at certain companies or within the healthcare system are not the bad guys here. It's just how the system is. There's so much inertia that has gotten us to where we are. And so it's just sort of reflecting upon that and working with the fabulous people who truly want to make a difference in the system and say, okay, let's start chipping away at it. We oftentimes get questions of like, what's the perfect way to engage patients and caregivers? Well, there is no perfect way. That's bananas. So we really want to say, let's start somewhere. And hopefully this will not be the only time to work in co-design with patients. Therefore, just keep doing it, and we'll continue to iterate and, build upon it as time goes on.
It's not only just the inertia, but I think also just it's the old standing institutional traditions and mindset, right? The old guard where, the doctor comes in, these are the orders. How dare you question those orders or ask a question, because they know better for you. Have you seen any shift in that dynamic or in that mindset? And that's for any of you to answer.
Yeah, I mean, this is really interesting, right? People always want to like now talk about like the empowered patient. And
Right.
yet I'm like, do you really want that? Are you willing to stand behind that? Because if patients come in informed and they've got their new app or whatever that, you know, some companies put out to help you either gather your health records or track your symptoms, and you've done your research. And I don't mean just any old site. You have your peer-reviewed journals that you're bringing into your doctor's office or things like this. We know that not all providers are as receptive to patients and families coming in with this kind of information. And so that's what I think about when I think about like patient empowerment. It's sort of taking their advocacy and their care into their own hands. And so we just need to reflect upon that. Is everybody open and welcoming to this? Because we can't go champion patients to develop these skills and ambitions to have, you know, access to their data and treatment options and things like this, and then sort of like shame them when they come into the clinic and say, no, you don't know. Because that's what I always get offended with. Here I am, somebody that's been living this my entire life, have a PhD. I walk into rooms where I am being brought in as the patient perspective and am not treated with the same level of respect as my other professional peers, literally because I have been identified as the patient voice in the room. And that's just inappropriate. To think that like your level of expertise is reduced because you're not sitting on the side of the table with the other professional experts. And so that's what I think. It's really just trying to make sure that people understand that everyone's perspective is valuable. It's just different. So,
and how is the work that the three of you are doing at Savvy transitioning that mindset into helping to, you know, create these co-creations of new solutions and new advocacy from the patient standpoint versus the healthcare provider standpoint?
You know, I have certainly seen a shift. I've been doing this for a very long time, but Savvy's been around for 7 years. And when I started this, there was a lot more pushback around, even here at Savvy, we make sure that patients and caregivers are fairly compensated for their time and expertise. And back then, people were like, oh my gosh, we couldn't possibly pay them. Like, that's coercion, or, oh, is it really worth it? You know, they're just patients, right? And so thankfully, I don't really have those conversations anymore. So I'm grateful for that we're seeing not only that it's valuable to get patient perspectives, but it's valuable from a monetary standpoint as well. So I think that there certainly has been a shift, and we haven't solved it all yet, but I think definitely there's been a meaningful change in the industry to really understand. And I think some of that honestly comes from renewed would even be a little bit of a hyperbole here, but an actual focus in diversity, equity, and inclusion. I think as more people have acknowledged that we need to have diverse, and I'm going to do it from the patient insight perspective, that has made companies or researchers or, you know, people in various practices say, okay, well, we used to think like, okay, maybe we can just guess what patients want. But I don't know that we can sit here and guess what, you know, patients from communities we don't belong to want. And so it really has made people stop and have to put the time and resources behind getting these kinds of insights that they may otherwise have just said, oh, well, I sprained my ankle once, I know the patient perspective. But they can't say that from, you know, they don't know what it feels like for Black and brown patients to be involved in whatever care challenges that they're experiencing. So it's really, I think, done a service to the patient insights industry at large to really focus on making sure we have more diverse voices in the conversations.
Sure, absolutely. I want to ask the three of you, what would a listener or a viewer find if they went to Savvy and they were interested in enrolling in this program and helping to be advocates for the work that Savvy is doing? What is that experience like, and how would they go about doing that?
So the main thing that they'll want to do is be a part of our platform. This is something that I focus on a lot in my work as the partnerships coordinator is getting people more involved with the projects that Savvy has going on. So we are disease agnostic. We work in lots and lots of different treatment areas and conditions. We always have projects that are coming through that are of diverse types of conditions. And so we always are looking to get more people to be a part of our table. We say that our table is never full. So how they can get a part or be a part of our platform is going to apply.savvy.coop. And from there, they can click sign up/sign in and then follow the prompts to be a part of our platform there so that they can see all of our available projects that we have each week. And they shift, they change each week too. So if you don't see, a treatment area that is maybe relevant to you in 1 week, it doesn't mean that we won't ever work in that treatment area.
Sure. Have any of you received any feedback or stories from any of the families or the caregivers that have utilized Savvy that you'd like to share? I see Vivek shaking his head.
No, we've worked with so many different patients, and I've only been here for, less than a year. And within that time, I've talked to so many patients who, commend the questions that were being asked to them. And they talk about how it really got me, it put me back in where I was, 5 years ago. And it really got me thinking about all these different things that were happening at that time. And apart from that, there's that feeling of you're contributing to some type of research. And a lot of different patients are very happy when they say that, or when they're done with a project or they're done with an interview and they're like, oh, I just spent an hour working with a scientist. And that was a very, very exciting, interesting, intriguing experience. It was great. And, apart from that, I think a very important part of the feedback that I've read or that I've received is just that it's really easy working with Savvy. A lot of times when you're working with a larger organization or you're part of a much larger research project, things get lost in logistics or you're not treated properly because people are busy, they have a busy schedule or things are going on. But at Savvy, because we have individual project managers, each patient is just given so much care and everyone is treated with so much patience, and that really comes through in the feedback.
I think it's important to note too that a lot of people on our team are patients and caregivers as well. So we come to a lot of the research that we do from a very empathetic perspective because a lot of the people who are doing that research are patients or caregivers too. And so, there's a difference when you're speaking to someone who has a similar experience to you or who at least can relate to you in a way that is more tangible and more real than working with a researcher who might not have that background, So I just wanted to make sure that we pointed that out as well.
Absolutely. Well, I know we just talked to a founder of a healthcare company last week, and one of the prerequisites for their company was if you weren't a patient or had not gone through a caregiving experience with a family member, you had to go through mandatory empathy training because they didn't want you on the team if you couldn't appreciate or at least have an understanding of what those people you're helping to serve have gone through. And I thought that was a wonderful idea because like you said, Eriel, if these people at Savvy have that experience, that's going to make them that more effective and relatable to the people they're serving. So that's tremendous. Did you have a story of anybody that stood out to you that you guys have worked with?
I was going to say I partner with lots of nonprofit organizations, and right now what I'm doing is I put together a Black History Month webinar series where I've been speaking to lots of Black-led organizations that Savvy has partnered with, and we've been talking about the gaps in the healthcare system, how their organizations are making it so that they're speaking with patients and allowing them to have the tools to become better self-advocates for themselves, and speaking with the leaders post webinar, it's been really great. They have always given me the feedback of that they've really had a great time with the conversation, and they've been happy to be a part of Savvy and a part of Savvy's work in really making sure that patient and caregiver voices are at the forefront of anything and everything that they do. And so, yeah, I mean, I think that the feedback in general has been really, really great. And I'm just excited to continue to grow with the company. I know we have lots and lots of things that we're looking to do to the future. And so I think that we're on a really wonderful track, and I'm excited to continue to push forward.
That's tremendous. Jen, do you have a story that you want to share?
Well, you're making me reflect on As a researcher who started our research program here, luckily, we have been able to bring other researchers into the fold as well. But in doing so, I'll note two things. First of all, it is part of our hiring practices to understand if people have some connection to the work that we do. So similarly to what you were just referencing around other companies providing, mandatory empathy training. Now, it is not something that disqualifies anybody from applying to Savvy, but we want to know that you are connected to our mission, that you understand what we're doing, because we care a whole darn lot about what we do. And this isn't just a job to us here at Savvy. We're all very connected to it. And whether that's because we are patients ourselves, or like my fabulous colleagues on the line, are connected to it because of our own sort of personal connections with our families, with historical injustices in seeking care and want to make it better. So that's important to us. And especially from the research standpoint, it's why we're really good at the research itself, right? Is because we're able to navigate the complex challenges that our clients, the companies, the researchers are trying to solve for. So we understand it from the business case, but yet at the same time, we know the patient experience, and that we're able to say, oh, if that person or that company needs to understand X, we need to ask the patients why. It might not seem like the quote unquote right question, but we know it's going to unearth what that client needs to hear. And as a researcher myself, when I am on the line with patients, I generally identify as saying, you know what, I'm a patient myself. I really don't tell anybody what I have, because that's not the point. It's not about me. But I just say, I'm a patient. We're here to actually hear your story, but I care about hearing your perspective. And it immediately disarms the conversation that they don't know what disease I have or what treatments I've had. But throughout the conversation, they will end up saying to me, oh, well, you know how it goes, you've been there. And it's that like immediate level of sort of like empathy that really creates more of that trusted space to share. And I just think that's so important in the work that we do. And we hear from patients over and over again, you know what, this was an amazing experience. No one has ever asked me my perspective. Or, wow, it was really interesting to answer some of these questions. I've never thought about my disease or my condition that way. And because I am that nerdy researcher, we can actually point to the literature to say when people are able to use their experiences, which are kind of lousy experiences, let's be honest, sometimes, for good, that can really change their self-concept. And when people have improved self-concept, it actually shows that it reduces healthcare utilization, decreases ER visits. So there is a through line here to the kind of work that we're doing to actually creating a positive change for people's health and well-being as well.
That's tremendous. Let me ask you, Jen, since you said, you're kind of being made to think back. When you look back 7 years ago and you're able to see the stories and the impact that, Vivek and, Eriel have shared, have you met your expectations of what you thought Savvy would do?
Well, that's a great question. Thinking back 7 years ago, huh? Well, I had less gray hair, a few less wrinkles, putting myself back in that mindset. It's interesting that you ask such a thing, and my teammates here will probably know my response, that I just feel like our work is not done yet.
It's just begun.
Yeah, I don't want to discount all the amazing work that, my colleagues have done to get us to this point, but our ambitions are to have the largest impact possible. So we aren't even, nearly scratching the surface of that. I'm proud of the work that we've done. I'm proud of the reputation that Savvy has. It was a company and organization with high integrity that patients and caregivers trust. Some of the things that I still kind of giggle about is that sometimes we'll see somebody post on Reddit or Twitter, like, hey, does anybody know about Savvy? Is this a scam? And patients, I have no idea who they are. Just people are weighing in going, no, Savvy's great. They are patients themselves. They pay us within 24 hours. Like that to me really speaks to what we've been trying to achieve, a trusted patient-led organization. And so I'm very proud of that. but we have so many more opportunities and places that we can go to have the largest impact, to work with the most companies, to get the most patient input so that we can make the most products and services that are inclusive and meaningful for patients and families.
No, that's wonderful. And, I think it's tremendous that there is a place where caregivers and the patients can both have an equal voice, if that's fair to say. Where now in your 7-year history, do you still find the most resistance to this concept and this idea that you're trying to implement? Is it the hospitals? Is it the medical establishment, insurance companies, or maybe it's something totally unrelated to healthcare?
Yeah, that's a wonderful question. I think there's a few different layers to it. In terms of like segments of the ecosystem, be it like you mentioned, hospitals and systems, payers, it does seem as though those who are working more directly with patients, and so that would be systems, providers, payers, I get more response from them. And it's like, oh, we know patients. We work with them every day. We send out a survey. There's your typical HCAP surveys after a clinical encounter or things like this. And so they're like, we know. We're like, do you? And do you know how people outside of your organization feel about you? Like, why are you not going to that hospital? Well, we need to go ask patients that maybe say, I heard from a neighbor that they had a terrible experience there.
Right.
Okay, well, we need to go understand that. So that's what I'd really like to see more of, is more sort of curiosity in those sorts of spaces. I think in terms of more globally, kind of segment agnostic, is just, it's a time thing. People go, oh gosh, we've already done X, Y, and Z. This is supposed to launch next week or in 2 months or whatever the timeline is. So if we stop and get, patient or family member input now, it could delay us a couple weeks. Okay, we'll delay a couple weeks then. Right. Why not get it right? So that's the kind of stuff, and I will happily talk anybody's ear off when it comes to things like that. But that's sort of the resistance, when it's like, oh gosh, well, we didn't plan for this and now we don't want to stop. I was talking to somebody at a conference just last week, and they essentially were saying this. They said, we want to deploy a survey in the work that we're doing that's going to be used over the course of a year or two. And if we stop now to get patient feedback on it before we deploy it, gosh, that's going to delay launch. Delay your launch for something that's going to last multiple years, and then you're going to get 2 years down the road and figure out you asked the wrong questions? Like, of course you should do that right now. So that's really what we want people to really think more thoughtfully about, of delaying a few weeks is much more important than getting to the end of the line and going, wow, we really mucked up.
Yeah. Well, and I know we had a well-known physician on a few months ago, and he's the head of one of the systems now, and we were talking about dementia. Now, this doesn't necessarily incorporate into the work Savvy's doing, but the mindset does. And my question to him was, why is it that, more families than not that we encounter, or that other people encounter who have been diagnosed with dementia, really when they get that diagnosis, they're only getting that diagnosis. The family is not getting the resources, the tools, or really the support once they leave that doctor's office or that hospital. And he says, it's really rooted into the mindset of medical education 60, 70 years ago, where if you couldn't treat it and cure it, you don't want to waste time on it. And my question to him was, how do you get to the root of that mindset? Because it just perpetuates itself year after year, decade after decade. How do you get to the mindset like you're experiencing with Savvy, with some of these systems and providers saying, well, we know our patients? Like, how do you get around that mindset and start to have them look at it from a different angle and have a different perspective?
Yeah, it's interesting that you talk about sort of like those resources that people are not being given, or things like that. Like, what's being shared in the hospital? How is it being shared? Interestingly enough, we're coming up here on my 10-year brain surgery anniversary, and it's made me reflect a bit on it. And I'll never forget what my mom said to me afterwards. And, it took me a while to come to, and therefore she was in the waiting room, and she called it the Tower of Sad Pamphlets. which was just all the different inserts for all the different types of brain tumors one could have. And incidentally, they couldn't even figure out the kind of tumor that I had. And they came and said, here's some options of what it is. And she's pulling out the Tower of Sad pamphlets, but nobody really talked to her about it. And she's actually a medical professional. And yet it was still so heartbreaking for her to sit there not knowing what was going on. And when we now work with the pharmaceutical companies, while you might think of them as just developing out the new therapies and drugs and treatments in that regard, a lot of what we do is actually help them think through what else patients need, because that's the patient experience and family experience, just as what you just described. And so, but it just shows that healthcare is so complex, because we could help them develop out resources for people and families, now managing dementia. But if providers are not trained to see this as a value add in their clinical encounter or their team or any sort of follow-up, then it doesn't even make it into the patient's hands, which is why people go on the internet and they search for things. So there's just so many different channels that we need to understand. And it's a lot of the work that we do is asking patients and families, where do you find information? How do you make treatment decisions? Because it's a lot of the time they're saying, hey, I'm going to social media. I'm finding those advocacy organizations. I'm asking my neighbor. I'm turning to my faith-based organization just for guidance and healing. So there's a lot of different avenues that do not happen in the clinic that people have to go to find the resources they need.
And in this, I'll open up to, anybody that'd like to respond, but there's also, I think, an effect too of trust, right? Especially, Eriel, for the African-American community, the testing that was done on African-Americans. Do you find that they are so willing and trusting even to take a Savvy survey or even accept a resource or, take a new vaccine when it's presented to them? How do you get around that issue?
It's a good question. I will say speaking about it from just, the cultural perspective.
Right.
There's a lot of work that needs to be done. I know, speaking with family members, about my new job and working with Savvy, there has been question of well, Eriel, why are you, doing this? There's been a little bit of hesitancy, and that hesitancy is warranted because of, like you said, all of the testing that has been done, just the historical issues that have happened to specifically African Americans in the healthcare industry. And I try my best to explain to them, if we aren't part of the solution, we are always going to have these issues. It's always going to be a problem. So we have to kind of, start taking those steps and working with Savvy, who, like I said before, walks the walk too. It makes it so that we can actually trust that, our input is going to actually be listened to and actually be, considered when we're working with organizations who actually do make it so that the patient and the caregiver voice is so important, and so, like I said, it's not a quick fix. It's not easy. There's a lot of work that has to be done to get that, to rebuild that trust. But I think that Savvy's doing a really wonderful job in making sure that trust is that, if there's an understanding of that hesitancy and that they're working to mend those sorts of relationships.
Well, in the work you're doing, especially, with Black History Month and the seminars or webinars that you're doing and meeting with a lot of these African-American community leaders and organizations, have you seen any inroads being made in that area?
Well, we have had people wanting to be a part of Savvy after watching that webinar. I've had people email, and, conversations with my colleagues have come up too, which has been really wonderful. So I think that there definitely is interest, and there's definitely, people who are coming to Savvy and understanding more of what we do after watching me have a conversation with a community leader. And so I'm excited to be a small part of that change and that shift, so yeah, I think that there definitely has been really positive impact and output from that.
A lot of small pieces make a full puzzle, though.
Exactly.
Vivek, what's some of the questions that you have had dealing with the contract situations with Savvy? Do people are they understanding? And, how does that look? If a viewer or listener who hopefully after, watching this and us sharing all this information and having all the links up and the wonderful information you guys provided us, and they contact Savvy and they want to sign up, what's that process look like for them at that point?
So for patients, I think it's a little bit different. For patients, you just need to access our platform. Once you're registered and you have access to all the different gigs that come in every Monday, it's that easy. It's just a few clicks and you can apply for a gig. And based on the inclusion criteria and what you've said in your application, we can either select you or not select you. It's very straightforward. But from a contracting perspective for patients, I think what I'd really like everybody to understand about the work that Savvy does is we're always advocating for the patient's best interests. So what we do at Savvy is we define all of a patient's personal data as eligible participant data. So in our contracts with all of our clients, when we're giving them research or when we're giving them the final work product after a project is completed, we make sure to define how that eligible participant data, or how that patient personal information is used by these different companies. And that's, I think, what sets us apart is that from the beginning to the end, we're focusing on how to make sure these patients are not taken advantage of. We're focusing on how to make sure that any personal information is either protected or the use of that personal information is defined somewhere, or is, we elaborate on that and make sure that companies can't just do whatever they want with our patients' insights and their experiences.
Wonderful. Jen, if we talk to you and Eriel and Vivek in 7 years from now, where is Savvy at?
I like this. Again, I think we're just trying to make sure that we can do this at scale. And we want it to be that it's just standard operating procedure, that no matter where you sit in the ecosystem, no matter what you're working on, from developing out clinical research to creating those educational resources to putting together a new patient and family initiative at your hospital, that there is no point in time that people have not gotten patient perspective. We'd love that to be through Savvy, but truly, I really just want to make sure that it is happening. So our contributions to this sort of patient and family member ecosystem around getting that engagement to get those insights, I am going to be a champion for. But we hope that you will continue to hear Savvy's name associated with doing this fine work to make it so that any organization has their own sort of Savvy group of patient and family members to tap into and to be able to get that invaluable patient insight to co-create those future innovations.
Wonderful. Now, the data, obviously, that you collect is all protected, it's secured, it's private. But are results ever posted, like statistics or any of the research? Is there any of that public information that's obviously protecting the identity of the participants? But is it compiled anywhere for public consumption?
Yeah, this is a great question. It depends on the project. Some of that is proprietary information because we're giving feedback on a particular app or a clinical trial or, service for a hospital. So these kind of things, we're not here to disclose that. But we do other sort of internal research projects, or we do other ones that are things that can be shared out. Some examples of the work that you can see are we did a larger survey with the American Medical Association about how individuals feel about their health data privacy. And so that's out there in the ecosystem. You can also see that our patients were involved in helping Amazon make sure that their Alexa devices could be used by people who have stutters and stammers. And so that was published upon to show the impact that kind of work had on making these devices more accessible. So there are certainly examples of the kind of work that we've done out there in the wild. You'll see some of our patients, their videos and testimonials and experiences and stories on various websites and campaigns. So there's a lot of evidence of us out there, but in terms of sharing out, reports and data like this, come back and check the website regularly as we're putting out more and more information there. I am old enough now to know that I need to tell you how to spell our website, savvy.coop. People will misspell both of it. So Savvy is SAVVY, 2 V's, not 2 A's, SAVVY.COOP, savvy.coop.
And I'm going to tell you that will probably be up on the screen as you're spelling it.
Great. Excellent. Yes.
Yeah.
That is something I did not expect when starting this, is how many people would misspell savvy. So
sure.
If I had a nickel every time it was misspelled, I would be a rich lady.
Okay. Well, listen, I want to thank all three of you so much for your time today. I just applaud and admire the tremendous work that all three of you are doing, and just Savvy in general. And we look forward to continuing the conversation with you guys again in the future. You're always welcome back. And like I said, we will have the links up in our show notes as well on the screen. And I think we have a video that's about to start as well for our viewers. Listeners will be able to see it on our official YouTube channel. And I just want to say thank you again to all three of you for your time today. It's been a pleasure.
Thank you
so much.
You're welcome. Have a great day.
For too long, companies have made products or services for patients, not with patients. And they've done so by either thinking that they know what patients want, or by asking doctors or patients that they already know, but they've already heard their perspective. And what doctors want isn't always the same thing as what patients want. The only way we know that is to ask patients directly. So patients want to know, why don't companies talk to them directly? The truth is, there are a lot of regulations that act sort of like a wall between the two. So what Savvy does is we actually take that wall and we make it into an online marketplace for patient insights, where companies can pay patients to share their insights here on the platform. And patients get to know that anything that they share here is done so privately. So what can we actually do here? Well, we can do things like gigs, which are surveys, focus groups, interviews, or other product testing. We can also do Sparks, which are questions that are posted right here on the platform for our friend Sally here and all her other patient friends to be able to chime in on. So Sally gets to use her experiences and know that they matter and get paid to do so. So Sally's savvy, are you? Join us at Savvy Cooperative.
Thank you so much for joining us today here at All Home Care Matters. All Home Care Matters is here to help families as they navigate these long-term care issues. We invite you to visit us at allhomecarematters.com, where there's a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to. And remember, you can listen to the show on any of your favorite podcast streaming platforms or watch the show on our official YouTube channel. Just make sure to hit that subscribe button so that you never miss an episode. We'd also like to say thank you again to the team from Savvy. We look forward to seeing you next time here at All Home Care Matters.
Thank you for joining us today. We look forward to you joining us again on another episode of All Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.